HIV in Kenya, where we are at today, is that over the last 5 years, we have seen a significant reduction in prevalence, from a prevalence of about 7% to about 5.6%. And I think in many ways you could say that's progress. And we also have seen a huge increase in the number of people who are living with HIV who are put on treatment. One, there's been a lot of work over the last 5 years that has meant that we see, I think, infections are not occurring as rapidly as they used to occur many years back. I think with treatment also, you are seeing less children that are born with HIV, significantly less numbers of children. And so when you put some of those factors together about the work that has gone in, and also we have increased the sexual debut, meaning that young people have their first sex much later than they did 5 years ago. So I think when you put all of those factors together, you do get a reduction.
This is the draft
That's
email.
just like a draft.
Okay.
We had challenges. We haven't seen that much of a reduction in the number of people who are getting newly infected per year, meaning that the people who are HIV negative, who are positive every year, seems to have stabilized rather than reducing, and perhaps that's not such a good sign. However, we have been able to see over the last 5 years a reduction in HIV transmission among children by almost half over the last 5 years. So I think, to sum up, from sort of population perspective, there has been progress, but there are still some major gaps. Some of them are around access to services, some of them are around reach, some of them are around just perhaps retargeting. Where we are at now is that the gap that we have is how we actually put all of those new people on treatment, which brings me then to another gap, which is around financing. We have not been, as a country, we haven't made a very significant contribution. The other gap that we have is stigma and discrimination. When you look at the total number of people who need to be on treatment, or who are HIV positive, almost half of them do not know their correct HIV status. A lot of it is because there's still a lot of stigma, there's still a lot of discrimination. We are actually saying that we want a future where actually we have no new infections. No new infections, absolutely none, and that's a possibility. We have no AIDS-related deaths, meaning that anyone who is HIV infected already actually has the quality of life that they should have, and that they have the care that they need, and they are on the treatment they need, so they actually do not die of HIV-related illnesses. And then the third thing is we are looking at zero discrimination and stigma. And so getting to zero, yes, it is possible. The stories that the media needs to focus on into the future is, I think, have to do with, one, counties. Because in many ways, counties are going to drive what happens in many areas in this country. And HIV is definitely one of those. I think another area that the media could help focus on is the whole idea of domestic financing. How does the media help us mobilize the resources that we need into the proposed HIV fund? The media need to be behind the sustainable financing agenda and keep it right where it should be in the public mind. I think the third area that I would like to say the media need to focus on is the area of stigma and discrimination. And this has many different angles. It has the angles around the different populations. We know that the populations that we serve are also populations whose activities are criminalized. But from the public health perspective, you have to provide a health service to everybody who needs it in this country. And that is what we strive to do. And therefore, the media need to be able to continue to support us, to be able to reduce stigma and discrimination. Such stigma and discrimination does not help the fight against HIV. If anything, it will drive those people underground. They won't get services. We're talking about more infections in the future. Over the World AIDS Day, we're going to be asking all the counties to launch their own county HIV data. And we are providing them with all the information and the data that is required for them to launch their HIV county data. So media pick up on that data and use that to build stories around HIV, around why we must invest as a society, around why we cannot have stigma and discrimination.